So now let's discuss about the neurobiology of ADHD disease. Okay, neurobiology is also a pathophysiology. That's what's wrong with this patient's brain, patient mind. Then for that you have to understand many things, but first you have to understand the basic thing, how our normal brain is working. Okay, so in context of this ADHD, we have to discuss the two neural circuit. Okay, we have to discuss the two neural circuit. The one is related with something called as the default system. Okay, default system. Fine. Another one is called as the task system. System. Now this is a very basic psychological concept, okay, or psychiatrical concept which we have to understand, and it is all related to how our brain is functioning. So it's quite easy to understand is that the default system is active. Okay, this system will active when we are doing nothing. When we are not doing anything, this system of our brain get activated. Okay, or basically we can say the default system is on that very moment, on that very time period. Suppose you don't have any tasks, okay, you don't have any work, you are simply sitting. Fine. On that very moment, this default system is taking care the neural processes. Fine, neural processes. Got it? No problem. Now, task system, as the name suggests, whenever we have any tasks, this system is in an active state. Fine. So now we are touching the circuits name. We are giving the circuits nomenclature. So in the default system, the first thing which is coming is our prefrontal cortex, dorsolateral prefrontal cortex. Write it down. Dorsolateral prefrontal cortex. Okay, the another circuit is the cingulate gyrus. Okay, these are the certain parts in our specific particular parts in our brain region which is involved in this default system. And remember, the default system is activated when we are doing nothing, when we have not any mental pressure. You know that in the yoga, the ultimate goal is to free from, in the meditation, in the modern language, the ultimate goal is to have nothing in the thinking process or having nothing in the sense. Are you getting my points? Means there will be absolute blindness, I cannot say. There will be a nothing, a full silence, a full peacefulness. You know, default system is working there also. Default system in their brain, for those state of the mind, this default system is also working. Are you getting my points? So this is about the default system, and what it is basically active when we don't have any tasks, or basically we are not engaged in any kind of work. No problem. Now coming to the task system. This task system basically allows us to have the normal behavior. Basically means when you want to stand up, this system will not allow you to stand up. Are you getting my points? When you want to do some aggressive behavior, this system will suppress those behavior. So basically this system is basically suppressing the impulses. They will basically restricting the undesired behaviors, like the scratching the nose. Are you getting my points? As we discussed now, that one of the symptoms is they are doing something which is like not good, the scratching the nose, the fidgeting, basically moving the hand, okay, tapping the you can say the bench. Are you getting my points? Yeah. So this task system will not allow to do those things. Basically it's restrict the unuseful, okay, or you can say the undesired behaviors. So this is the task system. Now in a normal person, this default system and this task systems, they are, you can say, communicating with each other. They are communicating with each other, first point. Second thing is, this default system and task system, they are communicating not in a one way, or you can say not in a one direction. They are in a opposite direction. They are in a opposite direction. That when you are in a default system, okay, this task system is not there. When you are in a task system, you are your default system is not there. Okay, so basically they are anti-correlated. They are anti-correlated. They are anti-correlated. Basically they oppose each other. But in the case of ADHD, both the system is going in a one way, working together. Both the system is working together. Now suppose both the system, if they are working together, means there will be no any balance. Fine. So if the person wants to focus on something, okay, they can't. If person want to scratch their you can say the lip or their hair, if they want to curl their hair, if you want to tap, this system is not, this task system is not opposed by the default system. Okay, it means person will do this thing. Are you getting my point? Basically default system and the task system, they are opposite, they are opposing each other. Suppose a person want to scratch, they want to scratch their cheek, like, okay. Now then this default system will oppose this task system. Default system is what? To not do anything. So they make the patient to, you can say, sit calm. Are you getting my point? So basically they are opposing each other. Okay, but in the case of ADHD, both the system goes on the way. Okay, they go hand by hand. Fine. So both the systems, they are working together. It means they smash, okay, they mess up all the you can say the neural processes, and person have those symptoms. Now in the 2015 in the biological nature journal, a journal name is biological psychiatry, one paper is published by the Spencer, and that paper is said that low dopamine hypothesis, low dopamine hypothesis. It is published in the 2015 in the Journal of Biological Psychiatry, and the paper is about the low dopamine hypothesis in the ADHD. Means this paper is saying basically there will be a less availability of dopamine in certain circuit in the brain, and that's why the person have these kind of symptoms. It means what dopamine is actually doing here? Is anything related with the dopamine? Yeah. You know that dopamine is called as the reward hormone. Dopamine also bring a person in a motivational state. Okay, dopamine also help you to focus. Okay, and it's also help you to be, you can say, aware about your present environment. Are you getting my point? So these are the functions of the dopamine, and here what is happening? The dopamine is either the less, you can say, secreted, or there is a very poor availability of a dopamine, a neurotransmitter in the brain region. So that's why the symptoms appear. Patient have not a motivation, patient can't focus properly, fine. Patient even as we discussed, that patient even not give the attention, okay, they forget the things, because working memory require dopamine, okay. As a neuromodulator, they need a dopamine to rewire their circuit, to rewire up their circuit. Dopamine is the very essential neurotransmitter, okay. Now here what? Here dopamine is working as a conductor. They are working as a conductor. Dopamine is working as a conductor. What it is doing? It basically activating these systems, that one time they activate the default system, another time they activate the task system, seesaw fashion, normal jhula type movement, okay. One time they go, you go, another time they say, dopamine say task system, you go, again one time this system you go, again another time you system you go. This is the function of dopamine. This is the function of dopamine to make these two systems, the default system and the task system, in such a way that they are considered as anti-correlated. They are opposing each other, and person will have the normal personality. But here, if the dopamine is less, then this anti-correlated behavior will be absent. Both the system will fire simultaneously. As a result, person have those kind of symptoms. They will forget the things, okay. They have the poor organizations, difficult to give the attention. There will be a high impulsivity, because we've seen that in the task system all the impulse are restricted. But here what is happening? No any regulation, both the system going simultaneously, okay, and these symptoms will appear. So we can easily infer here that we can provide a medicine or drug that will either stimulate the dopaminergic neuron to secrete the neuron, or they will suppress the reuptake process of the dopamine hormone to the presynaptic neuron. Okay, this is the two way to manage. So now once we understand the underlying neurobiology, let's here only discuss about the management.